When to use a COVID-19 self-test kit. If you have had COVID-19 in the past 90 days, you do not need to be tested unless you have new symptoms. If you have symptoms of COVID-19, self-isolate away from others and get tested as soon as possible. If you've been in contact with someone with COVID-19, take your test at least 5 days after exposure. If you don't have symptoms and have not been exposed to someone with COVID-19, consider testing before attending an indoor event or gathering. What to do if you test positive for COVID-19? Self-isolate away from others for 5 days. Wear a mask when you need to be around people for 10 days. Inform those who need to know, including your employer or school and any close contacts. Monitor your symptoms and contact your healthcare provider if necessary. What to do if you test negative for COVID-19? There is still a chance you could have COVID-19, especially if you have symptoms or have been exposed to someone with COVID-19. Consider repeating the self-test 1 to 2 days later or seek PCR testing. Taking more than one test can help you be sure that you do not have COVID-19. Check out these additional resources to learn more about keeping yourself and your family safe. This message was brought to you by the Hawaii State Department of Health.